Welcome to the Increlex injection demonstration video. In this video, we'll review why it is important to follow the dosing instructions provided by your child's doctor and how to prepare and deliver Increlex. It is vital that you follow the recommended dosing of Increlex. Not delivering enough of the active drug could result in a lack of efficacy. Similarly, administering too much may cause side effects which may have acute or long-term concerns. Use Increlex exactly as prescribed for your child. In order to avoid any issues related to low blood sugar, such as dizziness, tiredness, restlessness, irritability, hunger, trouble concentrating, sweating, nausea, and fast or irregular heartbeats, it's important to remember that Increlex should only be given if your child is able to eat within 20 minutes before or after the injection. The dose of Increlex is calculated by the doctor or nurse using a standardised formula that takes into consideration weight. If your child's weight changes as they grow, the dose will be adjusted by their doctor. Remember, Increlex should only be given if your child is able to eat within 20 minutes before or after the injection. Now let's review the steps for administering Increlex. We understand that injections can be intimidating for both the children receiving them and the caregivers who provide them. Over time, you and your child will develop a routine and become more comfortable with the injection process. Always follow the instructions for use and talk to your child's doctor for guidance and support. The vial should be removed from the fridge 20 minutes before the injection. It is important to wash your hands before preparing the injection and to always use a new, sterile, disposable needle and syringe. Needles and syringes must only be used once and should never be shared. Don't forget to check the lines on the syringe to see what units they are being measured in. Check the liquid to make sure it is clear and colourless. Do not use after the expiry date, which is stated on the label after EXP, where it refers to the last day of the month, or if it is cloudy or if you see bits. If a vial freezes, dispose appropriately. Ask your pharmacist how to throw away medicines you no longer use. Remove the protective cap, but do not remove the rubber stopper. The first step is to prepare the vial. Wipe the rubber stopper with an alcohol swab to prevent contamination. Then prepare the needle by withdrawing the plunger to draw an amount of air into the syringe that is equal to the Increlex dose. Now you're ready to push the needle into the vial. Push the needle through the rubber top of the vial and then push the plunger to inject air into the vial. Leave the syringe in the vial and turn both upside down. Hold the syringe and vial firmly. Make sure that the tip of the needle is in the liquid and then pull the plunger to withdraw the correct dose into the syringe. Before you take the needle out of the vial, check the syringe for air bubbles. If air bubbles are in the syringe, hold the vial and syringe with the needle straight up and tap the side of the syringe until the bubbles float to the top. Push the bubbles out by using the plunger and then draw liquid back until you have the correct dose. Remove the needle from the vial and replace the protective cap. Do not let the needle touch anything. You are now ready to inject. Increlex is injected subcutaneously or under the skin and can be administered in the upper arm, thigh, buttock or abdomen. The site of delivery should be rotated for each injection to help prevent the formation of a fatty lump under the skin. Use an alcohol wipe or soap and water to clean the skin in the area you are going to inject. Be sure the area is dry before you inject. When injecting, it is recommended to lightly pinch the skin, insert the needle and release the skin. Slowly push in the plunger of the syringe all the way, making sure you have injected all of the liquid. Once all of the solution has been injected, the needle can be removed. The injection is then finished. Pull the needle straight out and gently press with gauze or cotton for a few seconds, but do not rub the injection site. Follow the doctor's instructions for throwing away the needle. Do not recap the syringe. The used needle and syringe should be placed in a sharps container, such as a biohazard container, hard plastic container, such as a detergent bottle, or metal container, such as an empty coffee can. Such containers should be sealed and disposed of properly in the way your doctor described. If you would like more details on how to inject Increlex, please refer to the package leaflet. Increlex is the only recombinant human IGF-1 therapy available for the long-term treatment of growth failure in children ages 2 to 18 with confirmed severe primary IGF-1 deficiency.
Indication: Increlex meclosermin is a prescription medicine used in children 2 years and older with short stature that have severely low levels of the hormone, insulin-like growth factor 1, IGF-1. IGF-1 is needed for normal growth. Increlex is not a substitute for growth hormone. It cannot be used for children with short stature due to low levels of growth hormone, malnutrition, when their thyroid gland doesn't make enough thyroid hormone, or when taking anti-inflammatory steroids used to manage inflammation. Important safety information: always give Increlex exactly as your doctor directed. Do not take Increlex if you are allergic to IGF-1 or any of its other ingredients. Report any allergic reactions. Increlex should be injected under the skin. Subcutaneous injection. It should not be injected directly into a blood vessel. Increlex should not be used after growth plates close, which happens during puberty. Increlex should not be used in children with cancerous tumors or a history of cancer. Hypoglycemia. Low blood sugar. Increlex should be administered 20 minutes before or after a meal or snack and should not be administered when the meal or snack is skipped. Checking blood glucose levels is recommended. The dose of Increlex may need to be adjusted until an appropriate dose is decided by your doctor. Intracranial hypertension. Increased pressure in your skull may occur because of cerebrospinal fluid buildup around your brain. Therefore, your doctor may require an eye examination at the start of Increlex treatment and periodically during the time you are taking Increlex. Lymphoid tissue hypertrophy. Lymphoid tissue hypertrophy is a non-cancerous increase in the number of immune cells called lymphocytes. Patients should have periodic examinations with your doctor to rule out potential complications. Slipped capital femoral epiphysis. Slipped capital femoral epiphysis is a bone problem where the top of the upper leg, femur, slips apart. This may lead to a serious condition where bone tissue dies due to a lack of blood supply, osteonecrosis. Get medical help for your child right away if your child develops a limp or has hip or knee pain. Progression of scoliosis. Your doctor will monitor you during treatment with Increlex if you have a history of scoliosis. Malignant neoplasia. There have been reports of cancerous tumors in children who received Increlex. It is unknown whether there is any relationship between Increlex therapy and new occurrence of tumors. Tumors were mostly reported in patients with rare genetic conditions of short stature associated with a higher risk of cancer, or in patients already at risk of cancer. The tumors were seen more frequently in patients who received Increlex at higher than recommended doses or at doses that produced IGF-1 levels above normal for age and sex. Your doctor will carefully monitor you during your treatment with Increlex for development of tumors. If cancerous tumors develop, your doctor will stop your Increlex treatment. Risk of serious adverse reactions in infants due to benzyl alcohol preserved solution. Serious and fatal adverse reactions can occur in neonates and infants treated with benzyl alcohol preserved drugs. Use of Increlex in infants is not recommended. The most common adverse reactions include low blood sugar, reactions at the injection site or throughout your body, and enlarged tonsils. You are encouraged to report negative side effects of prescription drugs by contacting Eton Pharmaceuticals, Inc. at 1-855-224-0233 or the U.S. Food and Drug Administration. FDA at www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information for more information.